Self-harm is damaging, but it's very treatable. And you want to approach it appropriately so that you can end the behavior, because if you don't, you can easily exacerbate the behavior. So it's important to understand that self-harm is a negative coping mechanism to either distract or escape emotional pain or to communicate emotional pain. So the question is, what's a healthy way to address that emotional pain if it's not self-harm? Let's go through some steps. So the first is to identify the trigger. What happened that led to that headspace where you want to injure yourself? So it could be family conflict, it could be feeling left out, it could be isolation or feeling alone, whatever that situation is. Then you want to identify, number two, is what is the underlying emotion? Based on that trigger, what's the emotion that followed? So if you are dealing with family conflict, maybe the emotion is worthlessness or anxiety and fear. Or if it's isolation, maybe your emotion is feeling lonely and sad. Whatever that emotion is, give it a label. And it's not about condemning it, and it's not about trying to fix it right away. You're just identifying it mindfully, which leads to your third intervention, which is to nurture that emotion. Now, nurture can take a few forms. It can be a matter of practicing compassion that you feel that way. It could be acknowledging or even validating that you feel that way, that yes, it's difficult to feel alone, or sadness feels sad. And you can acknowledge that. And a good rule of thumb is to ask yourself, how would I treat a friend or a loved one if they had that emotion? How could I hold space for that person? How can I practice compassion and sympathy rather than judgment or shame or trying to stay stuck in it? Nurturing is also an important step to this because it helps address the reasons why someone may self-harm, which could be wanting to escape emotional pain or wanting to communicate emotional pain. And nurturing, it helps you to not be afraid of the emotional pain, that you don't need to escape it, that you can do something about it and you can step in. And nurturing also helps you connect with yourself so that you feel seen and heard and understood, and that helps you not need to show other people as much or feel the need for other people to see you so desperately. If self-harm is your reason for communicating your pain, you get to communicate it first to yourself, which is super important for you to start to feel seen and known when you see yourself. After practicing that nurturing, you get to move on to the fourth intervention, which is a coping skill. And a coping skill is a very generic term that can be something as simple as taking a walk and getting fresh air to change your scenery. It can be challenging your negative thoughts and even replacing them with positive ones or positive affirmations. It can be calling a friend and making sure you're not alone. It can be journaling and processing. Whatever that skill is, it's directly combating or addressing that negative emotion and that negative trigger that you identified. And so that skill is an important way to replace what you're going to do instead of the self-harm. So that skill will be customized based on what's going on with you. Fifth and final intervention is redirection. You need to move on to do something different, because if you dwell in whatever environment you're in or dwell on that emotion that's bothering you, then it's going to be tempting to self-harm because that's your pattern. That's what you're used to doing. It can even become an addiction. Redirect your thoughts, redirect your actions, and keep going. One of the most important things to remember if you struggle with self-harm is that you want to avoid blaming other people or blaming certain situations for being your trigger, because yes, those may happen. There's going to be disappointment and pain and hurt in life, and it's your responsibility to know how do you cope with that and how can you make sure that you take care of yourself even when you don't like the way life is going. That is the most important skill behind self-harm and the problem behind self-harm. It's up to you to learn that, and it's up to you to do something about that, even if someone is bothering you or triggering that. Don't get stuck in blaming the triggers. Move on to how you can intervene and take care of yourself.